Good afternoon and welcome to the UCSF Institute for Health Policy Studies Grand Rounds. We're just waiting for participants to all come into the webinar, and then we'll begin with introductions in just a moment. Great, it looks like everybody is in who wants to be in. I am very pleased for this August Grand Rounds for the Institute for Health Policy Studies to welcome Lisa Bero as our speaker. Lisa Bero is an international leader in research integrity, commercial determinants of health, and evidence synthesis. Lisa is also well known at UCSF as she was a tenured professor of health policy and clinical pharmacy for many years here. She left us for the opportunity to go to the University of Sydney in Australia, where she was the chair of health outcomes at the Charles Perkins Center from 2014 to 2020. While she was there, she founded their Evidence, Policy, and Influence collaborative research group with nodes on bias, evidence synthesis, and pharmaceutical policy. She's now professor at the University of Colorado in medicine and public health, and she is the chief scientist of their Center for Bioethics and Humanities. Lisa's international work continues as an advisor to the research group she founded at the University of Sydney and as the senior editor of research integrity for the Cochrane Library, where she is initiating Cochrane's research program on research integrity. She is also Public Health and Health System Network senior editor and was co-chair of the Cochrane Governing Board from 2014 through 2018. Dr. Barrow is a highly prolific author of scientific articles, and I don't have time to tell you everything I could about her service, her publishing, editorial work, international and national committees, consultations to government agencies, and training. But before I let her begin, I do want to note that she was the inaugural awardee of the very first Harold S. Luff Award for Mentoring in Health Services and Health Policy Research in 2009. It is a pleasure to have Lisa with us at IHPS today. So thank you, Lisa. I'll hand it over to you.
Great. Thank you so much, Joanne. It is really fantastic to join you guys. I'm trying to pull up my video. Here we go. So now you can see me. Thank you so much for that great introduction. And I can't tell you how much it means to be able to give a grand rounds at IHPS. And I was just saying to Joanna, I wish that I was there in person, and it would be so great, but I'll get there eventually to say hello again. So I am going to talk about evidence, policy, influence, and collaboration, because that really sums up my research program. That is the University of Colorado. You're looking at right there, our medical campus, my new home, which I have yet to set foot on actually in a year, but someday soon. I have an office waiting for me. And I do, as you know, I do a lot of work on conflicts of interest. So I have my disclosure there, and all my funding currently comes from the Australian government, the state of Colorado, and a bit from the Canadian government and Cochrane. So I'm really glad that, why isn't my, great, I'm really glad Joanne mentioned the Hal Luff Mentorship Award, because I pulled up this photo. It's from 2009, and it's when I received the award, and I thought, wasn't it great to have one photo with all the earlier leadership of IHPS in it? And of course, we have the late Phil Lee, our founder, who was a tremendous mentor to me, Hal Luff, our next director, and Claire Brindis, all in one picture, all of whom have been valuable mentors to me, as well as Drummond Rennie and Helene Lipton, names that are very familiar around IHPS. And this is Mildred Cho, who was actually my very first postdoc. Poor Mildred was a guinea pig. She's now at Stanford, but the first in a very, very long line of postdocs and students I've had the privilege to mentor. So this award meant so much to me, as did my time at UCSF. But before I get all choked up, as Joanna said, I was able to tear myself away from UCSF. And I have to say, this is one of the reasons I love water. And this was my local swimming pool in Sydney, Australia. The water's actually warm enough there to swim, and I could go there and swim 3 or 4 days a week. And these rock pools are very unique to Australia. And that's because in Australia, the sharks swim out there and the people swim in the rock pools. So that was a bit of an incentive to move to Australia. But the main reason was that I was able to found the Evidence Policy and Influence Collaborative. These are some of the folks that have worked with me there. 7 years really flies by, let me tell you. Over the years in Sydney, we had a big fancy modern building, but we also have the kind of more traditional ivy covered halls there. And as mentioned, I had 3 prongs to the research program that you'll hear a bit more about, but we were also part of Sydney-wide Sydney Initiative for Truth and a Sydney Health Ethics program. So really building on a model that IHPS has had for so many years of multidisciplinary collaboration to work in any particular area. So Barbara Mintzes, who's there in the yellow shirt, was one of the first people I recruited to the Evidence Policy and Influence Collaborative, and she continues as its director today. And as you might imagine, changing countries and jobs during a pandemic doesn't make for a smooth transition. I could be in Sydney for all you know right now, and I still have a lot of ongoing projects there. So you'll hear about a mix of what's happening. But now I've moved to very much calmer waters in Colorado. There's families and pandemics and life changes happen. And now I'm really thrilled to be here at the Center for Bioethics and Humanities, working with this wonderful group of people. And we've got a couple of folks here, Dr. Eric Campbell and Christine Baugh, who are absolute world leaders in conflict of interest research, which is one of my areas, and that we're hoping to build even more of here at the University of Colorado. So as I said, evidence, policy, and influence are really the words that describe the core of my research. So what the heck do I do anyway? This is a little graphic of what it means to me. So I think, and folks at IHPS totally get this, evidence is a foundation for policy. That is an assumption I make. And so we see that if we have trustworthy evidence, this will support systematic reviews, health guidelines, and higher level health policies. But if anything threatens the base, the evidence base, and by that I mean how you design the research, ask the questions, conduct the research, how it gets out in the public domain, then the whole thing falls down. It all crumbles. And as my career has gone on, I was very much interested at first in the influence of evidence on policy. So that's where the influence comes in. But I became more and more interested in influences on evidence itself, because when we see that evidence can be manipulated or corrupted, then it threatens that whole foundation for evidence-based policy. And recently I was asked to contribute to a book on commercial determinants of health. And I have to say, it's really nice after working in an area for 20 years or so that it actually has a name. So the commercial determinants of health are defined here. And this is how it's defined for the book. And these are direct influences that you can easily think of: marketing, regulation. But my area is really funding unreliable or misleading research aimed at generating doubt about product harms, but also about funding, conducting, and publishing research that might promote false efficacy. So it goes both ways. And because the influences on evidence can really be detected when you do evidence synthesis, that's why evidence synthesis and the work I've done with Cochrane for these many years has been a big part of my research program. I've recently founded the Colorado program on evidence synthesis, and in very Colorado fashion, our first project is going to be a scoping review on harms of cannabis. And that's very interesting from a methodological standpoint because we're looking at harms, not benefits. And I've done a lot of work over the years in methods for using evidence in public health decisions, not necessarily clinical, which is more complicated, and in various types of guidance, particularly with WHO and governments. And then the other area of research that I really focus on is studying bias, and conflicts of interest are a big part of that. So these financial influences on the evidence base and financial influences, not only by funding research, but by funding researchers themselves. And this is very related to looking at aspects of research integrity. And so how do we actually make sure we produce trustworthy evidence that's asking relevant questions and is understandable to people and can be used for policy. So those are very closely related. So now I'm just going to give you a flavor for how we do this type of work in my team and where we're going. So bias. Everybody thinks they know what bias is. So what is it and how do we study it? And this is a definition I actually used from Cochrane. And bias is a systematic error or deviation from the truth in the results. And the really important thing to realize is that bias can go in either direction. It can over or underestimate the true effects. So bias is a concern, for example, if you're overestimating efficacy of a drug, but you don't want to underestimate the harms of a drug or of some environmental exposure, for example. So how do we actually study bias and quantify it? Well, I said I do a lot of research in research integrity, and that can be summarized as meta research. So meta research is research on research. And this is Bailey, who's a bit of an internet sensation. And Bailey is what's known as a meta pug. So Bailey is a pug dog wearing a pug suit. Isn't he cute? He's adorable. And the kind of stuff I do isn't nearly so cute, but it is the same as a pug dog wearing a pug suit. So this is a meta-analysis. I'm sure all of you have seen figures like this. And this is a Cochrane review, actually, that is looking at studies that have examined the association of pharmaceutical industry funding of drug trials with the outcomes of the trials. And this looks at all these individual studies and puts them together. And we find that pharmaceutical industry funded studies are about 30% more likely to have a finding that favors the drug than studies that are funded by other sponsors. And this is a very, very consistent effect across all sorts of different pharmaceutical areas. And you may think, well, 30% isn't much, but actually that's a pretty big effect size because most cardiovascular drugs, for example, would be in the ballpark of reducing heart attacks or mortality by around 20 to 30%. Oncology drugs are even less effective. So that's a pretty big effect size. And this has actually led to all sorts of research in different areas to actually quantify the biases that might be due to industry funding or conflicts of interest. And most recently in Sydney, we tackled this with nutrition research, which is interesting because most of that is observational and not randomized trials. And this is Nick Chartres, and I show you his photo because Nick was a PhD student with me in Sydney, and he's now working with Tracy Woodruff at UCSF. So when you all are back on campus, you may see him around. But for his PhD project, he tackled the question of, is industry funding or author conflicts of interest in nutrition research associated with results or conclusions that favor the sponsor compared to other sponsors or non-food sponsors, for example? And the answer was yes. And he did this kind of meta research to figure this out. And he found that it's this funding bias, and this is now there's an encyclopedia of bias, it's now an official term, funding bias, has really been found across a wide variety of industries. And it's found to be associated with not only the results of studies, but the conclusions. And this is really important because for the media or for press releases or summaries for the community, the conclusions, if they're influenced, that can be really important. If you're a meta researcher, you don't really care about the conclusions. You don't even read them if you're making a guideline or a systematic review, but you might be concerned about the statistical significance of the results, and you'll definitely be concerned about the effect sizes. So this meta research is really important to show that not only are the conclusions affected, but the actual data on a particular topic. So as I mentioned, we've looked at this across a wide variety of industry areas. But this is an observation, right? So we observe that funding or conflicts of interest is associated with a bias. And so the next big question is, how does this happen? And this is actually work I did with John OBrien way back when at UCSF, when I used to teach a course on critical appraisal, and I taught my students about the cycle of bias. They always said I could teach them a great class in biasing a drug trial, and I think I could. But this is the cycle I'm talking about. So first, you need to have set the research agenda, design the research question. You can introduce bias there. You can introduce bias in the methods that are actually used to conduct the study. You can introduce bias in how the study is conducted behind the scenes. So even if it has a rigorous method, it might not be conducted according to that method. And then you can introduce bias in terms of what actually gets published from the study or not, and whether those conclusions might be spun. So we have looked at all of these different aspects of bias and how corporate funding can introduce bias in different parts of this cycle. So I don't have time to summarize that, but I'll just say this involves a huge variety of methods, such as massive amounts of document analysis, so comparing drug trial data that's submitted to regulatory agencies, protocols that are submitted to trial registries with what actually gets published, by looking at internal documents. UCSF, as you know, has the greatest resource of internal documents, starting with tobacco documents. I've worked with now pharmaceutical, chemical documents, and these can really tell you what's going on behind the scene. And then we also do quite a lot of interview studies, talking to people who are involved in different parts of this research cycle to see what's really going on. And as I said, we have demonstrated industry influence at all of these stages. And just to show you a couple of examples, Alice Fabry, who was a PhD student with me in Sydney, now based in the UK, explored this issue of corporate influence on research agendas. And what was really interesting here is when she started and did a scoping review on this topic, we saw that it had been demonstrated across a variety of industries: tobacco, food, biotechnology, chemicals, mining, even some gambling, which is actually a very big topic for study in Australia. So again, these strategies that corporations use to influence research aren't limited to just one type of company. And Alice actually focused on looking at, again, some work in nutrition. And we found through looking at various transparency databases, we examined research funded internationally by Coca-Cola and found that Coca-Cola was more likely to fund research on exercise or the benefits of physical therapy than they were on the harms of sugar. And this would make sense, right? But this might not necessarily be the best questions for public health needs. So are those the questions we need answered? And we had previously shown this for secondhand smoke, that the tobacco industry funded research to distract from the harm of secondhand smoke by, for example, looking at how carpet off gassing or having a green plant in your office affected the air you breathed, rather than focusing on secondhand smoke. So this is one of the aspects of manipulating a research agenda, is to focus on distracting from harm of your product, which might not be the best questions for public health. Now, in terms of what gets published or not, this is just a gross simplification of some work I did with students and fellows back at UCSF, who painstakingly looked at documents that were submitted to regulatory agencies on drugs and compared them to what was actually published. And what we saw here was that, about half the time, unfavorable outcomes were published. Well, that's not a very good publication rate. And also, just a little over half the time, primary outcomes were published. And this is really important because these studies are designed around the primary outcomes. So they're the ones that really ought to be published. So there was a massive amount of selective reporting going on for drug studies. And again, this has been demonstrated using different methods across different industries, different types of drugs. And the internal documents really give us insight into this data suppression. So this is an example from a drug company document. We did a paper on this long ago, and it basically was very blatant about saying which trials would be published and which trials would not, based on their results. And working with Kay Dickerson at Johns Hopkins, we published a paper following up all these trials, and indeed, what was planned in the documents played out in the medical literature. And the studies that were favorable to the drug were the ones that got published, and the outcomes that were favorable. And this is still active area of research. These documents are just gold mines. And I'm currently collaborating with Tracy Woodruff, who's affiliated with IHPS, of course, and Nadia Gaber. And we have just submitted a paper that's looking at research on this chemical, which is a PFAS, lots of fluorines. That's a really nasty chemical. It's in fire retardants and things like that. And I'm not going to tip you to the full content of that paper, but there's a quote in there that says, well, better late than never to publish data on the harms of this chemical. So this data suppression, again, is seen across varying industries. Now, one part of publication, as I mentioned, is the actual spin you can put on the data and how the conclusions come out. And so we've also looked not only at selective publication of results, but also spinning of the findings of these papers. And again, we did a meta-research study on this, looking at spin in the biomedical literature. And this has also been studied across a wide variety of fields, both for randomized control trials and for observational studies. And interestingly, of the 35 studies on spin, 30 of them gave a really good definition of what they meant by spin. And there were various practices, but they may basically involve distorting the interpretation somehow to make the results look more favorable than the data actually suggest, a discordance between the results and the conclusions, inappropriate attribution of causality given the study design, and then inappropriate extrapolation or recommendations for practice. And in this pool of studies, spin was more prevalent in the observational designs and least prevalent in the systematic reviews. But this is select samples. I wouldn't hold to those data. Now, I do a lot of methodological research, which can be really dry and dull, but I have to say, I just love the work I do. And in fact, I'll never forget, I got a teaching evaluation at UCSF once that said they'd never had a professor who was so at one with her subject. And I think this is an example of me being that. One of my big goals in life, and I think you all need a kind of goal like this, that's a fun one, was to get an article in the holiday issue of the British Medical Journal, because they publish only joke articles, but they can't have fabricated data. So you have to have real data. And we decided to do a study of spin in studies of spin. And if that's not meta, I don't know what is. And what was great is they accepted this paper. So one of my lifelong goals was achieved. But what I liked is they let us publish a conclusion for the paper and then a conclusion with spin. And of course, I like the conclusion with spin because it has the more research needed, I need more money for my kind of research statement in it, which is definitely extrapolating beyond the findings of the study. So it was a lot of fun to do that. And this was with Quinn Grundy, who was a PhD student here with Ruth Malone, and who then came and did a postdoc with me in Sydney. Quinn did a lot of substantive work, primarily on non-financial interests and conflicts of interest in the nursing profession, but collaborated on this and is now an assistant professor in Toronto. So just to kind of put all this together in a very recent study we did, this is a really hot topic, what to do with preprints and what is the level of research integrity with preprints, particularly in terms of COVID-19. So preprints are non-peer-reviewed articles that are put up on some sort of server. They just skyrocketed during COVID-19. And so we wanted to know if preprints, if we could compare them to their finalized journal publication, how were they different? Was there evidence of incomplete reporting, outcome reporting biases, or spin? And this is really important for groups that do systematic reviews like Cochrane, because we want to know, should we include preprints in systematic reviews? So we were able to find 67 pairs of preprints that were published. Now, interestingly, most preprints on COVID are never published in a journal. We didn't look at those. We looked at the ones that were actually also published in a journal. And first, looking at outcome reporting, we saw that about a third of them had no discrepancies at all in outcome reporting, which was great. But some had outcomes that were introduced in the paper that weren't in the preprint. And this was mainly data on toxicity. So this is a problem, right? So the preprint does not report the data on harms. Only the final publication reported the data on harms. So again, small numbers, but a big omission. And then we also just had various missing outcomes. So they didn't line up in the papers and the preprints. And then we had other discrepancies in terms of numerical values, time points examined, statistical tests, things like that. So then we looked at spin, and we used a priori categorization of spin that we had developed based on our review. And kind of the bad news here is that spin was prevalent in both the journal publications and the preprints. I wouldn't say that one was really worse than the other. In 5 publications, spin that was in the preprint was actually removed, but in one publication, spin that was not in the preprint was added in the journal publication. And these are the common types of spin that I had mentioned before. So we did publish this paper as a preprint, and then we've also published it as a peer-reviewed article. And when we published the preprint, it was very interesting because people posted comments like, well, I wonder if the article will differ from the preprint. And in our case, it really is pretty much identical. And I just want to say one thing, it's hard to teach an old dog new tricks, but one thing I have really adopted over the last 7 years or so has been these research integrity practices, like publishing protocols, preprints, making all of my data sets available. And it has been great to be at an institution that really has supported and facilitated all of those research integrity practices. So our preprint paper actually had an impact on policy at Cochrane. We will include preprints as long as we have enough information to assess their risk of bias like we would for a regular paper. And that's an example of influence on little policy. And I would say that my work and our work over the years, we really do want to translate our research into policy at both those smaller levels and bigger levels. And I actually really think advocacy is important. And not only do we try to get our work into policy, but we really try to advocate for change. So I'll just give a couple of examples of that to wrap up. And I have to say, this is what I really learned and took with me forever from IHPS, was to really take that research and do something with it to try to influence practice or policy. So evidence synthesis, you might think, well, it's just a method, what's the big deal? But actually evidence synthesis has become, and Tracy Woodruff is one of the world's experts on this, but has become a really hot topic in the field of environmental health. I've been involved in several National Academy of Science reports looking at, for example, EPA's methods to do risk assessment for hazardous chemicals. And the bottom line is that EPA is incorporating more systematic review methods into their processes. And this has just been great to see as somebody coming from Cochrane and really seeing the struggle that it was to even get systematic reviews accepted for clinical practice guidelines, moving away from the good old boys sit around the table method. And that took decades. And now to see systematic reviews being so influential in environmental health is just great. And this is definitely an ongoing process. There's lots of methodological work that needs to be done. Now in Australia, systematic reviews have a much higher profile actually. So there's a national guideline agency like most countries have that we don't have. In Australia, these guidelines always have to be based on systematic reviews. But in Australia, they have adopted systematic review so much that, and sometimes the term becomes corrupted as it does here in the US. And so again, industry could use systematic review methods to their advantage. So one of my current PhD students, and I still have two in Sydney who are finishing up, this is Sally McDonald, is looking at a regulation in Australia that requires a systematic review to be produced to support every food claim made. And this is by their food regulatory agency. So a food claim can be something like this: water is good for normal physical and cognitive function, for example. So they had to produce a systematic review to support that claim. And then there's this one, Australian almonds are good for heart health. And I'm sure I've seen exactly almost the same figures and definitely exactly the same claim for California almonds. I don't think there's any difference between Australian and California almonds in that regard. But again, in Australia, a systematic review had to be produced to support this claim that a handful of almonds will improve heart health. Now, what's interesting about this is these systematic reviews have to be produced by the company making the claim, and they're not publicly available. So Sally, for her PhD project, is looking into the creation of this regulation, but we're obtaining these systematic reviews and analyzing them for their rigor and quality, because it just doesn't seem right that a systematic review serves the basis, but it's not available to the public. So we'll see how that goes. And speaking of transparency in the United States, I'm sure you've all heard of the Open Payments database. I was involved with Paul Thacker, Henry Waxman way back when the Open Payments was being created. It's been an active source of data for many folks at UCSF. Lots of great work coming out from the Open Payments. And so these are basically payments from pharmaceutical companies to physicians. And Australia actually has its own Open Payments database. And so we made this a big focus of our work. But interestingly, in Australia, the Open Payments weren't so open. You would be able to download a PDF from each company. And so if you were looking for, and there were no physician names at first, it was basically a nightmare to work with. So we made all of the data publicly available in a usable form. So that's just to say that data can be publicly available, but if nobody can use it, it doesn't do much good. And so part of our work was to make all this data available in a searchable way. And the Australian data has some really unique aspects in terms of what was disclosed. First of all, it included payments to other healthcare professionals like nurses and pharmacists. The open payments data is now going to include payments to nurses in the US, which is a big deal. That'll be starting coming out in 2022. But in Australia, we got all healthcare professionals. They changed their database to exclude food and beverage at one point, and there's been a lot of research showing that even small payments affect prescribing. And when they did that, $4.5 million a month went away. That was being spent on just food and beverage. And then this pink bar here is very interesting because they also disclose payments to consumer or patient groups in Australia. And this has been a big debate internationally about pharmaceutical industry support of consumer groups. So we published a whole bunch of peer-reviewed papers from these data, but I just want to highlight some work by Lisa Parker, who did follow-up qualitative research with consumer groups about the payments to consumer groups, because this is just an example, I think, of our advocacy and converting our research into policy. So based on all of Lisa's work, we developed a model for what consumer groups think about in terms of taking this funding. What are the risks, what are the benefits, and what kind of policies they should have around this. And this all culminated in a meeting, I'm sad to say, the last meeting I attended before COVID in Australia, that we organized with the peak consumer bodies in Australia to develop guidance for consumer pharmaceutical industry relationships. And we thought this was so important because it was based on research. And up until that time, the only guidance available was actually written by the pharmaceutical industry in Australia. So this was the first independent guidance. And there's a whole series of webinars still ongoing to implement this in Australia. So I'll just finish up with a word on public health guidelines and conflicts of interest. So how evidence is used in public health guidelines is been a big focus of our translational activities. And by public health guidelines, I mean things that aren't randomized controlled trials of clinical interventions. So WHO does a lot of these on protecting people from harm, or diet guidelines around sugar in the diet, things like that. And Joy, who had a particular interest in diet, who worked with me in Sydney, we looked at the quality, and again, we have a protocol here and a final publication of guidelines on bone health, which was a particular interest to Joy. And I was interested in comparing these public health guidelines to the WHO methods for conducting guidelines. And I've been very involved in this handbook that WHO uses for guideline development. So this summarizes what we found for these bone guidelines. And there are many criteria here. First of all, in addition to the evidence that I want you to note that goes into guideline development. And the red areas show where these bone guidelines did very poorly. So they didn't have good diversity on their guideline committees. They were really good, 75% disclosed conflicts of interest, but only 15% actually managed the conflicts of interest. And surprisingly, they did quite poorly on using systematic reviews. Only 11% of these bone guidelines were based on systematic reviews. Again, these are global guidelines. And they also did fairly poorly on integrating issues around health equity or acceptability or feasibility. So clearly there is a long way to go in terms of improving the quality and rigor of public health guidelines. And that's something I've been working on a lot with the NHMRC, which is the national producer of guidelines in Australia, who has an online guideline development modules. So every guideline approved in Australia has to meet these criteria. And we've been very involved in the sections on managing conflict of interest, which is not very surprising, but also working, and again, this was a collaborative effort with colleagues at UCSF, Tracy Woodruff, WHO, Susan Norris, the National Toxicology Program, and universities in Sydney and NHMRC to develop their guidance on assessing risk of bias for the types of studies that are used in public health guidelines. So generally observational, epidemiological type studies. And Jeff, his dissertation was actually on adaptation of WHO guidelines, but this was one of his side projects. So again, we feel that, you know, these kind of small policies have been extremely influential in changing and improving the way guidelines are developed. And lastly, now that I'm at an ethics institute, I realize I do what they call ethics consulting quite a bit. And I do consulting around conflicts of interest. So I'm the external one and only conflict of interest advisor for Health Canada, advising on conflicts of interest management for their cannabis and their nutrition dietary guidelines. So of course, controversial guidelines. I do the same thing for NHMRC, COVID living guidelines. And of course, for Cochrane, part of my role there is advising and managing conflicts of interest. We have a very, very strict policy. So all this involvement in conflicts of interest can lead to some interesting times. At UCSF, I had quite a bit of interaction with industry that was unhappy with my work, and UCSF had to come to my defense. What was interesting was when I moved to Australia, I wasn't really thinking about it, but I certainly wasn't thinking this would follow me. And very soon after moving to Australia, this appeared in the paper. There was a series of emails that was leaked to an Australian journalist. I hadn't seen them prior to him getting them, that Coca-Cola was now monitoring my work at the University of Sydney because they were quite concerned about the work I did on conflicts of interest and investigation of funding bias. And as you saw, Alice Fabry did a project related to Coca-Cola funded research, which prior to this, we weren't actually thinking of focusing on Coca-Cola, but then we couldn't resist. But again, Coca-Cola has not been our only focus. So that was kind of my welcome to Australia. And now that I'm gone, a colleague of mine was interviewing the head of a food industry organization who said, well, she can upset the food industry over there now on finding out I had returned to the US. So we'll see what happens. So far, it's smooth sailing. And just to end on a positive note, this idea of commercial determinants of health and commercial influence on research is something, you know, I've been talking about really for decades, but it is so rewarding to see how the field has really changed. And there's a lot more attention to this. There's a lot stricter rules, both in terms of research production and research publication. And this is just a whole series in the British Medical Journal that I led with Ray Moynihan. And some of you may remember Ray. He was a Harkness fellow who actually visited us at UCSF and has become a very good colleague of mine. Now he's back in Australia during my time in Australia. And we led this series on moving from transparency to independence, because transparency just isn't enough. And this series has a lot of research articles published, but what's most exciting to me is they're very solution-focused articles about changing the research enterprise. And we also had a call to action, and thousands of people have signed on to the call to action to reduce these commercial influences on research. So I really thank you for the opportunity to talk about all this, and I really hope we get to collaborate on future projects. Thanks.
Thanks so much, Lisa. For those of you who are attending, we have a question and answer option that you can type in your questions. And somebody already has, Dean Schillinger, who I think you probably know, Lisa, observed and would love your feedback on the process of revising papers in response to editorial review. And so when you compared the preprints to the articles, you would expect that papers might change. Certainly, I'm in economics, and it is pretty well known in our field that papers will get eviscerated in the editorial processes, often over a 2-year period of time before they finally get into a published journal. So, what are your thoughts about how to distinguish what might be acceptable revision versus there's something fishy going on here revision?
Yeah, well, that's a great question. And hi, Dean. I think that one is we were actually surprised that the final papers were so similar to the papers that were published, and we weren't looking at things like changing in language and tidying up. And obviously, they had a lot of tidying up. We were really focused on just the outcome reporting and the spin. And I think one reason we might not have seen such a big change is because it was the COVID area. And we know that a lot of papers have been sort of pushed through and accelerated through the peer review process because they are COVID papers. And so maybe they didn't quite get the level of scrutiny. We couldn't actually look at the level of peer review that they got. Although I have to say that years ago, we enrolled 3 journals in a study. This is a work I did with Elizabeth Boyd at UCSF. And we looked at papers that were submitted to these 3 journals. And these are 3 top medical journals, and then the final publications. And, again, there was not that much change due to the peer review. So that was surprising to us as well. So, I don't know. I mean, I think our paper does question the value of peer review. And of course, other models have been put forward that people should just, publish their data, and then various interpretations of it can be published online as a form of peer review. But it is hard because the COVID, I think, maybe there were some shortcuts taken. And I have to say, our COVID paper had 5 peer reviewers. And the reason we published it as a preprint was it took over 6 months in peer review. So it got a heck of a lot of scrutiny. But in the end, it wasn't that different from our preprint.
Another question came in also from Dean, where he observes that industry has promoted intellectual conflicts of interest as needing to be disclosed. So this may create a false equivalency. What are your thoughts?
Yeah, so actually, Quinn Grundy, who I mentioned, and I have done a lot of work on that. So these so-called intellectual or non-financial conflicts of interest. And, basically, we view these as an ethical shorthand for concerns that people have about bias. So we really think it's most important to focus on the financial conflicts of interest. Research is not interest-free, so people will come with their own pet hypotheses, their own personal experiences and background. And I think in social science, people have been used to managing this type of thing for years, right? They do reflexivity, they assess whether when coming to a particular research question, they're getting a balance of views, and they try to make that transparent. So the thing is, these intellectual or non-financial interests, they cannot be managed in the way that the financial can. The financial ones, we can reduce them, we can eliminate them, and also, but we can't do that. So we have to manage these other interests and beliefs that people bring in a different way. And I think the second issue, we've done some interview research around this. It can also really introduce discrimination in the review process. So for example, we've talked to people on guideline committees who have been excluded because they're experts on the topic, or they've been excluded because they're a woman, frankly, who might have a particular view on an issue related to children. or they've been asked really, really invasive questions, for example, about their experience with abortion. So you tread a very thin ethical line when you start asking people about their prior experiences and beliefs. And also these beliefs, sort of the criticism of them, nutrition's a great area. They've also been normalized so that white Western beliefs are kind of the accepted ones. So for example, people have been asked to disclose if they do yoga or if they have a vegetarian diet when they're on a dietary guideline committee, but they're not asked to disclose if they eat meat, for example. So we really, I think, have to be extremely careful about these ethical shorthands for concerns about bias. And we need to be transparent and try to get balance in that regard. And we need to really stamp out the influence of financial conflicts of interest, because we know that they are of a certain magnitude and they go in a certain direction.
Yep, I'll observe that not all the social sciences have a long track record of that. Economics as a field has added conflict of interest statements to some of the journals relatively recently, which as a health economist, I found rather alarming. I hadn't tracked it in quite some time, but it seemed a little weird that they were coming to that so many years after it has been standard practice in the healthcare literature.
Yeah, clinical fields have been on the forefront there. I mean, the basic scientists, science journals have really been behind there too.
Yeah, yeah. So Sarah Garrett, who's one of our doctoral fellows, observed, of course, that this is a really impressive body of work, and she's really curious about the increasing reach of individual researchers via Twitter or other social media venues, and how that might figure into future research on bias, such as, is bias playing out differently via social media as compared to traditional channels?
I think that is a great area for future exploration. I can't give you a definitive answer. I do know that we, Adam Dunn and Quinn Grundy and I did a small study looking at altmetric scores of researchers who disclosed financial conflicts of interest versus those who didn't. And those who had the financial conflicts of interest were likely to have had higher altmetric scores. So they seemed active, much more active in the social media. One thing we know about industry funding, it can also, really help get a message out. They have a lot of their own social media and Twitter feeds, for example, about their funded research. So I think there can be some amplification there of the messages related to the financially conflicted investigators. What we couldn't tell from that study is, maybe the studies were just, more interesting somehow, so we didn't control for that, but I think that is really a great area to investigate.
Yep, you need to have like a hot topics indicate control variable.
Yeah, I know. And it varies by the week sometimes.
Exactly. Kirsten Bibbins Domingo, who I'm sure you know, asked about, has an interesting question. So Kaiser Health News recently reported on a National Academy's report about the industry practice of drug pricing, that the report failed to acknowledge prior consulting of committee members for industry. Only current active consulting was disclosed or reported and considered. So what are some approaches for managing conflicts for consensus guideline panels, given the desire to have committee members that have expertise, and that expertise over a long period of time may result in these kinds of industry conflicts of interest, depending on how far back in time you look? What are some approaches you might recommend around that?
Yeah, that's exactly what I'm doing kind of with Health Canada and the NHMRC. So first of all, I am, as a member of these National Academy committees, I am still shocked that they actually don't disclose these things. Yeah, I think they should, but the model we've developed for these other committees, which are consensus committees, but they are based on evidence. So often they use systematic reviews, but it's really a sort of a risk assessment model. And if you have disclosures to the body doing the guideline, and you have some group that has a matrix for assessing the risk of a particular conflict of interest to the recommendations of the guideline, you could, for example, rate the risk as a high, a moderate, or a low or no risk. And then it's really up to balancing the risk of the conflict of interest to the recommendation with the other factors you need on that committee, right? So the conflict of interest is one thing you look at, and that's why I like being a conflict of interest advisor, because, you know, this is like the view on conflicts of interest, but then the people who have to put the committee together may say, well, you know, this is the only person in the world who could actually provide input on this particular topic. So then there's a decision to be made. Should that person be part of the committee at all? Should they just be a consultant to the committee, or should they be part of the committee but not be allowed to ratify recommendations? Should they be allowed to participate in discussion but not be allowed to draft recommendations and ratify them? So there are different ways of managing the risk presented by the conflict of interest, but still trying to balance the views that you get on your committee. But I think the really important thing is, you know, some committees feel that, you know, they just collect these disclosures and they put them in a file, and, you know, that's it, they're done. And that's not managing the conflict at all or minimizing the risk.
So Joe Geidish asks, I think, a question that's somewhat related. What should journal editors be doing beyond conflict of interest disclosures to counteract industry influence on science?
Yeah, well, that has definitely come up in this commercial influence series that the BMJ has been doing. So some journals have been very aggressive in that regard. Cochrane, for example, does not allow any Cochrane review to be funded by a sponsor that would have a financial interest in the outcome of the review. There are some journals that I'm sure, Joe, you would know about that don't allow tobacco industry research to be funded due to the poor track record of the tobacco industry. There's actually debate that some journals wouldn't publish clinical trials that are funded by, you know, the company whose product is being tested. So some journals are debating that. And Joanne, you probably know about this, but I mean, some journals actually won't publish economic analyses if they're sponsored by a company. So an economic analysis of a specific product. So that's one way that of really doing more is saying we're not going to actually publish certain types of research because we think the risk of the funding or conflict of interest is so high. So that's like one level. And then the other level is to really, I think, enforce some of the conflict of interest guidance. That's one thing journals haven't been very good at. Now we know with all the open payments database analyses that, you know, the rate of non-disclosure is just massive, right? So, well, maybe I'm exaggerating, but it's big, and at least in the area of pharmaceuticals. And so some journals are also talking about, you know, basically, you know, putting sanctions, for a lack of a better word, on people who aren't disclosing truthfully.
Thanks so much. It is the top of the hour. There were other questions that were asked that I would love to get into, but I think everybody could find Lisa's email address pretty easily. And we all know that Lisa, you know, Coca-Cola probably can too. And we all know that Lisa is extremely generous with her time. So I encourage anybody who has additional questions and want to pick Lisa's brain to do so. And we hope to get you out here in person.
Oh, I hope so. I miss you all so much. So
yes.
Thank you again. It has just been a delight this last hour. Thank you so much.
Thank you, everybody, for joining us for this month's Grand Rounds. And next month, we have Marianne Bittler presenting, who is from University of California, Davis.